Ladies and gentlemen, there's a nationwide doctor shortage going on in the country. Rural America, of course, will suffer the hardest because they don't pay doctors well. You know, this country has that problem. They want back-breaking labor and then they want to throw peanuts at you. And they think that this kind of thinking and dealing with people that are working for you will suffice. This is going to work less and less for them in the future, y'all. You just wait and see. I know what I'm talking about. This came out on ABC 7 WJLA. A nationwide doctor shortage is looming. Rural areas will take the hardest hit. This is October 31st, 2019. A nationwide doctor shortage is looming, with the United States potentially short more than 100,000 doctors in the next decade, with experts predicting rural parts of the country taking the hardest impact. Both state and federal government organizations are making investments designed to fill the gap and channel physicians to areas in need. Well, those doctors ain't gonna go near the rural area because they don't pay you shit. I mean, seriously, pay people a decent wage and you can eliminate a lot of these shortages that are going on. Dr. Jesse Hurd is a country doctor and a medical Mr. Fix-It. Considering where he works, he said he doesn't have much choice. Hurd is a physician at a clinic in Michigan's isolated Upper Peninsula, where some patients have to drive as far as 100 miles to see him. There have been days where I have gone from psychiatry to stitching up a 32 centimeter laceration from a bandsaw, Hurd said. So as you can see, here is the areas across the country. Well, if it's nationwide, then it would definitely be in every state. This is interesting. Let me see if I want to zoom in on this map, see what this says. Okay. Yeah, the green dots are showing you areas where they have shortage. Wow. Interesting. In Michigan, 1.7 million people lack access to primary care services. But doctor shortages are not limited to that state. In fact, the federal government has already labeled hundreds of places health professional shortage areas, with organizations including the Association of American Medical Colleges have sounded the alarm about an impending doctor shortage for years. Dr. Atul Grover is the executive vice president of AAMC, which released data in April showing that by 2032, the United States will see a shortage of up to 122,000 doctors. During an interview with our partner, Full Measure, Grover explained the shortage could be chalked up to several factors. They include population growth, aging, and a cap on congressional funding that covers the residency training doctors needed. And AAMC's research shows the South and Midwest have the biggest demand for physicians down the road. To fill the demands in those areas, as well as other underserved population nationwide, the federal government is stepping in. Loan repayment of up to $50,000 is offered to physicians who commit to 2 years of service in shortage areas. as part of the National Health Service Corp. Spotlight on America discovered more than 2,400 physicians are currently enrolled in the program, which funded more than 25 million in loan repayment in fiscal 2019. As a whole, the NHSA has an even larger budget, rewarding $319 million this year in both scholarships and loan repayment for clinicians in its program, which includes doctors as well as nurses and other health practitioners who serve millions of patients nationwide, mostly in the community health centers. States are also innovating to fill the gap. In Michigan, a new program called MID Docs, Mid Docs, is creating funding and educational collaborations to channel doctors to to underserved areas. So, what they are doing is, I guess they're trying to entice people there, but I don't know if this is going to work, y'all, because I mean, look, if you went through med school, because it is very expensive to go through med school, would you want to go to an area that pays you 30,000 a year as a doctor? Or would you want to go to a bigger city where you can easily get six figures? You know? And like I said, if they don't do anything about the pay, I don't see how they're going to lure all of these doctors there, even after offering to repay loans. I mean, what are you asking them to live on? Because I know I have relatives in rural Georgia, and I know those doctors don't get hardly anything as far as pay is concerned. Okay, so what are they going to do? In my opinion, the rural areas are going to be the first parts of this country to sink, and they will not be able to bounce back. I really do. The rural areas have been struggling for a very long time. It has been going on for decades. And many of these people are elderly, and it's very difficult for them to travel long distances just to see a doctor. Now, I also did a video showing foreign doctors coming over and working in those rural areas, and many of them do. They'll come from other India and Pakistan and all those places, and they will come over here and be doctors in the rural areas. But wow, I don't know what they're going to do. So they're already telling you well in advance there's going to be a doctor shortage nationwide in America. And people better pay attention to this, especially if you are the kind of person that is going to the doctors, taking your children. What are you going to do if you are in a shortage area? What are you going to do about it? Do you have an alternative on what you can do? Are you willing to travel 100 miles to go see a doctor? Many of us are not in that situation, but some people really truly are in America, and they always have been. But please tell me what you think about this story. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.